Hello and welcome to the second webinar of the Hallways to Health Sustainability Planning Learning Series. The Learning Series is designed to support Hallways to Health sites sustain their efforts into the future. The Learning Series is comprised of recording webinars accompanied by tools and resources helping you throughout the sustainability planning process as your Hallways to Health program prepares for the end of the grant. The second module, Engaging Stakeholders, walks through the key steps to identify and prioritize which stakeholders you want to engage to support your sustainability efforts and to develop your strategy for engaging critical stakeholders. As a champion for Hallways to Health, you likely already engage stakeholders on some level to either inform them about Hallways to Health or request their support in some way. As you prepare to sustain the work beyond the grant period, it is likely that you will need to engage at least one, if not more, stakeholder to help sustain the work, whether this is the CBHC sponsor, a payer like Medicaid or a health plan, your school or district or foundation. This module will help you hone your skills so that you and your sustainability team can effectively engage the most critical stakeholders who will impact the sustainability of your Hallways to Health work. The objectives for this webinar are to identify the reasons for engaging stakeholders in your work to sustain Hallways to Health, understand how you can identify which stakeholders to engage and the best way to engage them, and finally, learn how to plan that will allow you to engage identified stakeholders. Module 2 is designed to provide resources to Hallways to Health sustainability teams with the steps to create a thoughtful plan to reach out to the right stakeholders in the right way. The ultimate goal is that these stakeholders support the sustainability of Hallways to Health in whatever way best supports your sustainability vision. Module 2 builds off the work you did in Module 1. The sustainability team you established in Tool 1, the sustainability team roster, should be working together to complete this module. The purpose of establishing your sustainability team was to increase your capacity to plan for sustainability. Having a team working on the planning process not only spreads the work among multiple people, but also means leveraging the skills, resources, and connections that sustainability team members bring to your work. Your sustainability team should meet at least once, if not more, throughout the next few months to discuss, develop, and implement your sustainability plan. Creating a stakeholder engagement plan is a key element to developing your sustainability plan. Also, in Module 1, each Hallways to Health site developed a sustainability vision, which was Tool 2. This vision should guide all of your work on sustainability through the rest of the grant period. For this module, Module 2, you will want to ensure all of your decisions about who, how, and why to engage certain stakeholders is guided by and fits with your sustainability vision. In this webinar, we will introduce 4 more tools. These tools will support your sustainability team as you develop your plan for reaching out to stakeholders. How you watch this webinar and complete these tools is up to you. You can watch this webinar first individually or as a team and complete the tools afterwards, or you can watch the webinar and complete each tool as we go along by pausing the presentation. Your state affiliate will provide assistance throughout this process and can answer any questions you may have about the module or how to complete the tools. Before we dive into the tools that will help you develop a plan to engage stakeholders in Hallways to Health sustainability, let's quickly touch on the question, who are stakeholders? The definition of a stakeholder is one who is involved in or affected by a course of action. To frame this same question in terms of your work with Hallways to Health, you can think about the question, who is involved in or affected by Hallways to Health? And then specific to sustaining Hallways, think about the question, who is involved in or affected by Hallways to Health being sustained? You can begin to jot down the answers to these questions, but in a moment we will introduce a tool that will help you capture the list of potential stakeholders. Also, as you begin to brainstorm the answers to these questions, you may find that some of these stakeholders are already represented on your sustainability team. However, there are likely many more stakeholders who are not on the sustainability team and may even be outside the typical partners you work or interact with. Let's look at some Hallways to Health stakeholders that we have heard about at regional meetings or in your progress reports with who you are already engaging. There are stakeholders that are the recipients of Hallways to Health activities, like students and school staff, and stakeholders who oversee these individuals, such as the parents, school leaders, and school district leaders, such as the school board. The school board is a stakeholder for Hallways to Health because Hallways to Health has an impact on students and staff populations and thereby directly impacts the school board work as it enacts any district level health and wellness policies. A school board could support or hinder efforts to sustain the Hallways to Health work by building Hallways to Health work into existing or new district level wellness policies, or connecting Hallways to Health with district resources and vendors like nutrition and transportation. Some stakeholders have a common mission and or goals of Hallways to Health, such as community-based organizations, including food banks and before and after school programs. Funders may also share common goals or at least similar priorities, including foundations, health plans, and Medicaid. Finally, healthcare providers are potential stakeholders that share a similar mission or goal, including hospitals, mental health centers, and even your school-based health center sponsor organization. Your SBHC sponsor organization's interests and activities may align with some of their current or planned efforts if they are trying to increase their outreach and touch points within the school and community. They also could influence the sustainability of Hallways to Health by agreeing to financially support the work or connecting the sustainability team with potential funding opportunities. Reaching out to and engaging stakeholders in your efforts to sustain Hallways to Health can help you in a few different ways. First, a stakeholder may share information or insight that will inform your plan for continuing the work. For example, a principal may not be able to commit school district funding to some of your work, but they may have insight into what school funding is available and how the funding is distributed. Their insight may be critical to developing your sustainability plan. Another reason to engage stakeholders is to increase a stakeholder's interest in Hallways to Health. Reaching out to stakeholders can help develop new partnerships or open the door to new funding sources. For example, a community coalition or collaborative with a shared vision for population health work could help connect you to additional funding sources by sharing ideas, facilitating introductions, or providing funds directly to you. If it is a coalition with grant or funding opportunities, partnering with a community coalition may allow you to share cost, resources, and the burden of the work as well. Ultimately, the goal of engaging stakeholders in Hallways to Health is to acquire the resources to continue the work. This includes obtaining any funds you need to continue Hallways through grants, reimbursements for services, incentive payments, or school funds. But this also includes gaining or strengthening non-financial resources, such as volunteers and donations. So how can stakeholders help your Hallways to Health site reach your sustainability vision? Tool 5, the template for engagement objectives, is designed to help your sustainability team to identify what you hope to accomplish by engaging stakeholders and a list of some short and long-term steps you will need to take to accomplish that goal. By completing Tool 5, your team is agreeing on your reason for reaching out to stakeholders and ensuring it aligns with your vision for sustainability. The tool has two parts. The first part which is on the slide, is used to identify what you hope to accomplish by engaging stakeholders, or your objectives. The second half is used to list some of the short and long-term steps you will need to take to reach these objectives. The second piece, the short and long-term steps, will be used later in Tool 8 as you develop your plan to engage stakeholders. You may already be engaging stakeholders to support Hallways to Health sustainability. If so, reflect on your reasoning for engaging these stakeholders and the short and long-term steps you are undertaking. Let's look at an example engagement objective sheet. In this example, we have South High School. Their sustainability vision, noted on this slide, is our program will be integrated and an essential part of the school district to improve outcomes both academically, psychosocially, and physically for students, faculty, and staff. Collaboration with community partners, key stakeholders will enhance sustainability vision. Successful Hallway to Health activities, including staffing, will be maintained. Here, South High School lists in quick bullet points what they hope to accomplish by reaching out to stakeholders. They want to increase buy-in from community groups to support Hallways to Health, identify and pursue innovating funding opportunities, and to build relationships with people or organizations that can influence decision makers. They note that these objectives will help them achieve their sustainability vision by getting the attention of other community groups who are working on population health and can help integrate Hallways to Health into their community. This directly addresses the portion of their vision statement that states their intent to collaborate with community partners and increase sustainability visibility. Stakeholder engagement will also help them to find funding that will allow them to maintain Hallways to Health staffing levels well into the future. This directly addresses their desire to maintain funding needed to do this. They confirm that ultimately their reasons for engaging stakeholders align with their sustainability vision. Next, South High School's sustainability team lists a few short-term activities they would need to take to reach the objectives they listed above. This is located on the bottom half of Tool 5. We define short-term as activities that could get done in the next 6 months. They decided they needed to identify community coalitions that shared similar goals of Hallways to Health. In their community, they have a few coalitions whose work aligns with their Hallways to Health efforts, including Healthy Communities, an Accountable Health Community, and a Public Health Coalition. After identifying these groups, they plan to present to the coalitions during one of their regular meeting times. The presentation will explain Hallway to Health focus areas and achievements and the need to sustain the work. This presentation would be similar to a storyboard presentation with an ask created from a message box, which was your Tool 4 in Module 1 at the end. This is an excellent short-term strategy for stakeholder engagement. We recommend that each of your stakeholder engagement plans include at least one presentation or site visit to or with an external stakeholder. Finally, following the coalition presentations, South High School plans to meet one-on-one with any community organizations who express interest in and/or ideas on how to sustain Hallways to Health. Also, South High School's sustainability team noted that one long-term activity that they would like to take a little more time to achieve would be to approach new or innovative funding sources in partnership with some community groups to focus on community-wide population efforts. Note that South High School simply lists the key short and long-term activities to reach their objectives. At the end of this webinar, we will present a tool called the Stakeholder Engagement Plan template that provides more detail on these short-term activities, including who, how, and why the stakeholder is being engaged. After identifying the reasons you want to engage stakeholders, it's time to decide who to engage. But how do you decide who should be engaged? As we discussed at the beginning of this webinar, there are many stakeholders who are affected by Hallways to Health, from students and staff to principals and school boards to health payers and funders. It's time to brainstorm all of the stakeholders who will be affected by or involved in Hallways to Health sustainability. This includes any individuals or organization who could enhance Hallways to Health sustainability, as well as those who could impede or create a barrier to Hallways to Health sustainability. This could be a very big list, and that is okay. It is best to start out with a big brainstormed list of stakeholders so that you are more likely to be more creative and think outside the box of your typical stakeholders. Later, you will select only a few stakeholders to engage, but start with a broad brainstorm list first. Tool 6, Top 25 Hallways to Health Sustainability Stakeholders, is a resource to help you brainstorm that broader list of stakeholders. It is broken out into 4 categories to help you think of stakeholders in different buckets. These include community members and groups, such as students, student organizations, parents, and community groups. Funders, like health plans, Medicaid, and foundations. Healthcare providers, such as your sponsor organization, hospitals, and community health and/or mental health centers. And finally, school personnel, like school administrators, staff, and school board. We recommend that you try to identify 5 organizations or people in each category. As you brainstorm who these stakeholders are, think about stakeholders who can support Hallways to Health sustainability. If your site has already developed a list of stakeholders, or you completed this activity in the June 2016 in-person meeting, you can use that information to complete this tool. You can choose to list the same stakeholders, or you can update or expand the list based on input from the entire sustainability team. Here is an example of what the sustainability team at South High brainstormed on their top 25 worksheet. Their stakeholders for community groups and funders/legislators include a statewide mental health coalition, a statewide education collaborative, their local Medicaid accountable care organizations, or ACOs, a local Medicaid health plan that has been piloting innovative population health incentives, and the Medicaid state agency. Their stakeholders for school personnel and healthcare providers included their children's hospital, network of community health centers, also called the Primary Care Association, school leaders, the School Wellness Committee, and the School Medicaid Program. This is a big list, so let's discuss how to prioritize which stakeholders. So how do you determine which stakeholder to engage? The key is to figure out which stakeholders have the biggest impact on your sustainability vision. To do this, you first need to analyze your stakeholders you identified in Tool 6. Some of the key questions that will help you analyze stakeholders are: what motivates the stakeholder? What is their financial and/or interest? What information do they have? How are they influenced? Tool 7, the Stakeholder Map, is a resource that will help you to map stakeholder by their interest in Hallways to Health and its sustainability, as well as their influence on Hallways sustainability. Let's take a look. The Stakeholder Map helps you prioritize stakeholders by assessing their level of interest and influence related to sustaining Hallways to Health. You can plot up to 25 stakeholders from Tool 6 in the area that best represents the stakeholders' interests and influence. The Stakeholder Map also shows how best to engage stakeholders depending on where they are on the grid. While you can map all 25 stakeholders on this grid, it can get a little full. So we recommend that you map around 5 to 8 stakeholders here. On the Stakeholder Map, the axis shows the level of interest that a stakeholder has in sustaining hallways to health. The closer to the left on the x-axis, the less interest the stakeholder has, and the further right, the more interest. The y-axis shows the level of influence they have in sustaining hallways to health. The closer to the bottom on the y-axis, the less influence the stakeholder has, and the further up, the more influence. The more interest the stakeholder has in hallways to health sustainability, the further to the right on the grid. The more influence they have, the higher up on the grid. For example, a very influential stakeholder with little interest in hallways to health sustainability will be at the top left-hand corner. To help assess stakeholders' interest and influence, you can ask yourself the following questions. How does hallways to health align with the organization's or person's thinking and/or current work? What power does this organization or person have to impact our sustainability vision? Because you are trying to determine the stakeholders' interest and influence, you are going to have to make some best guesses and assumptions. Use the knowledge of all of your sustainability team members to answer these questions, as some team members may have insight into the interest and influence of some of your stakeholders. When completing this tool, we encourage you to map at least 2 stakeholders who fall into the red box, your high interest and high influence stakeholders, and at least 1 to 2 in each of your blue boxes, which are stakeholders with mixed interest and influence. Let's look at a stakeholder map from our example site, South High School. Here they mapped 4 stakeholders with high influence and interest. Note that Medicaid agency has the most influence of all 4 stakeholders in the red box, so it is near the top of the grid, while the Colorado Education Division still has high influence, but it is lower than 3 stakeholders above it. If you look to the blue box to the left, the SBHC sponsor has high influence, but moderate to low interest. Your sustainability team should work together to map out your stakeholders, as team members may have different opinions or information on the stakeholder's level of interest and influence. Since you will need to plot organization names in specific places on the grid, for example, one organization on the upper right-hand corner of the red box and another in the lower left corner of the red box, we recommend you print this tool out and write the organization names by hand. This is much easier than trying to type words into the tool and move them around where you want them on the grid. Once you complete the tool by hand, you can scan the document or take a picture with your cell phone and email the photo to yourself or directly to SBHA. The stakeholder map helps to prioritize which stakeholders you should engage, as well as how best to engage them. You should prioritize stakeholders who are in the red box. These are high-influence, high-interest stakeholders who are more likely to influence hallways to health sustainability. You can also decide to engage stakeholders in the blue box, but you can be more selective on which you want to engage. The graphic above, which is also included in Tool 7, explains which stakeholder to prioritize and how best to engage them. For example, low influence, low interest, which is the bottom left corner, stakeholders only require occasional contact in case their influence or interest changes. High influence, high interest, the upper right-hand corner, stakeholders are most impacted by hallways to health sustainability and empowered to do something about it. They should be engaged in sustainability. The final step of the process is to develop your plan for what your team wants to do to engage stakeholders. To develop your plan, you will use all of the information you pulled together in Tools 5 through 7. Your plan should use the objectives you established in Tool 5 and the list of prioritized stakeholders you developed in Tools 6 and 7. So you have already pulled together the information needed to inform your stakeholder engagement plan. Your engagement will detail who, how, and why you are engaging the stakeholders you selected. Tool 8 is a template you can fill out to describe your plan for engaging up to 4 stakeholders. On the top of the template, you simply need to copy your sustainability vision from Tool 2 and your objectives for engaging stakeholders from Tool 5. In the next section, you will answer 7 questions about each stakeholder you want to engage. On the left-hand side, you will write the name of the stakeholder. Next to that stakeholder, you will answer the questions about why, how, and who will engage this stakeholder. This includes a question about the key message or messages you will use to engage the stakeholder. This is a great place to use your message box to develop a message specific to this stakeholder. Before moving on to show you an example of the stakeholder engagement plan, it is important to note that stakeholders may change over time. Some organizations shift priorities, staff change, or you realize that a different person or organization may be more influential or interested in Hallways to Health sustainability. You can modify your stakeholder list to accommodate any of these shifts. Let's look at an example plan from South High School. At the top, you see their sustainability vision statement and 3 objectives they established for engaging stakeholders that we discussed earlier. Through their stakeholder engagement, they want to increase buy-in from community organizations, identify and pursue opportunities for innovative long-term funding, and build relationships with stakeholders who have the ear of decision makers. They decided to reach out to their local Healthy Communities Coalition, which is a collaboration of multiple organizations in their community that have been working for almost a decade on physical inactivity, unhealthy eating, and tobacco use and exposure to secondhand smoke. In the top row, South High School's sustainability team notes that the Healthy Communities Coalition is also interested in increasing the health of the entire community through population health efforts, and that they have influence with local funders, as well as provide grants to local organizations themselves. In the middle row, South High School's team notes that they are hoping the coalition's role can be to connect them to key decision makers who could be big funders for Hallway to Health, including a possible grant from the coalition themselves. And in the bottom row, South High School's team states they envision that engaging the coalition will also help them to integrate Hallways to Health work into the community and further move beyond the school-based health center and school walls. In the final 4 questions, South High School sustainability team describes who is going to reach out to the coalition, how they will reach out, and by when. This ensures the South High School team has a plan in place for actually engaging the stakeholder. They also document their outcome so they know how they will know they have been successful in engaging the stakeholder. Finally, using a message box, they have a clear, concise message for the coalition, which states stakeholders need to understand the value of Hallways to Health. The work of Hallways to Health supports the mission of Healthy Communities. Healthy Communities can help us to identify funding sources to sustain our work. This will help ensure the Hallway to Health continues and is fully integrated into our community beyond the school or school-based health center walls. As each of your sustainability teams develops your engagement plan, include any stakeholders that you are already engaging around sustainability. As mentioned at the beginning of this webinar, all of the work that you complete in modules 1 and 2 are building towards your final sustainability work plan. The work plan, which will be the focus of Module 3, will incorporate your sustainability vision and stakeholder engagement plan to further develop your overall plan for sustaining Hallways to Health beyond the grant period. Many of you are already thinking about or even working on sustainability, and some of you are getting underway. Documenting your sustainability plan is a final deliverable for your grant. The tools you complete in the Sustainability Planning Learning Series were designed to help each Hallways to Health site develop a realistic, effective, and meaningful sustainability plan. Each site has worked hard over the past years to implement many incredible approaches and policies that benefit the students, staff, schools, and community. Sustainability planning will ensure that this work continues and maybe even grows in the future. This concludes the webinar for Module 2. Please use the guidance presented in this webinar to now complete tools 5 through 8 with your sustainability team. Thank you.